Hi, I'm Amy Whitham. I work on the social prescribing team at BPRCVS, working with patients from the Pendle West Primary Care Network. And this is a story of a recent referral that was made to me and the support that I gave to the patient. This lady was referred to me by a GP for support with social isolation and low mood. She didn't speak any English and had only recently moved to the country, so had very little support network apart from her partner. She'd had long-term struggles with depression and her mental health, which had worsened due to being away from family, and also with the current restrictions and the language barrier making getting to know people quite difficult. When I spoke to her at initial assessment, the things that were important to her were getting support with her mental health, a move to being closer to family, and to have more people to talk to and to socialise with. So after that initial assessment, support was given over the phone using language line with the translator, and also some in-person sessions using a translator app. She seemed really keen to improve her English, so she agreed to a referral to an ESOL class that was starting quite soon after. This would include some social activities as well, so it would cover the things that she needed. I also supported with communication with Minds Matter after they'd initially closed the referral because of non-contact, after a misunderstanding because she didn't understand the letter that they sent to her home. So liaising with agencies like that, giving them the opportunity to arrange appointments through me so that she didn't miss out on that support. I also supported with some practical issues, things like downloading apps onto her phone, contacting the emergency dentist, liaising with the practice, and sorting out travel expenses for getting to her language classes. Also, just being a point of contact for her. It was quite difficult in a foreign country. The language isn't your first language. It's quite stressful for her at times. So being a point of contact, if she had anything that she needed, just knowing that she could send me a text message and I would get back to her and support her if needed, I think that offered her a great comfort, really. So outcomes, she's still open to me, she's still attending the ESOL classes, which she's been enjoying. They're now taking place on video call twice a week because of the COVID restrictions, but she's becoming a lot more confident in her English. She's meeting people, she's having that chance to talk to people outside of the family. GP has written a letter to Home Office in support of a move to somewhere closer to family, and an organisation called Migrant Help are also supporting her with that. She is going to be starting counselling soon with Minds Matter, with a translator, which she's feeling really positive about, and hoping that just that opportunity to be able to talk to somebody about how she's feeling will make a big difference. She also wants to get out and do some gardening, which is something that she used to do in her home country. So I'm looking at helping her to start volunteering at a local community allotment scheme once they reopen after the COVID restrictions are eased. At that point, it'll be a good opportunity for me to close her case with me, because she'll have a really good support network around her, and hopefully her mood will continue to improve. She's been really grateful for the support that she's received. She's said numerous times she's grateful for the help that I'm giving her, and what a difference it's made. It's really been good for her. So I think it just shows the difference that social prescribing makes just in that one person's life. It can make a huge difference just having that time to listen and to support people when they need it. Okay, thanks. Bye.